Hello, and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today on the program, we're going to be discussing the effect of moderate alcohol use on your health. I think that most of us are pretty aware that heavy drinking is bad for you. That said, today I wanted to focus on moderate alcohol use. You know, the word moderate itself implies that there are no health consequences to alcohol use. You know, my father always used to tell me, Peter, the key to all things is moderation. And I agree with him in a lot of things. But unfortunately, it turns out that moderate alcohol use does have some deleterious health consequences. And in my opinion, that's unfortunate because, you know, like a lot of other folks, I like to have a couple drinks now and again. And so one of the things I really wanted to do was look into this so I could honestly say to myself, Peter, you enjoy having a couple drinks. Is this okay for you? How bad is it for you? You know, where's the balance? And that's what we're going to come up with today. I wanted to start off by saying that alcohol is not new. One researcher that I found said that as long as there has been human civilization, there has been alcohol. The earliest known proven use of alcohol was back in 13,000 BC in Haifa, Israel, where in some caves, some anthropologists discovered some ceremonial jugs on which they did some chemical analysis and found traces of alcohol. I think that's interesting from two standpoints. Number one, 13,000 BC. And number two is that the alcohol traces were found on ceremonial jugs, and we're going to get back to that in a little bit. This is certainly not the only, this is not an isolated case of alcohol use in the Neolithic period. I could go on for a long time and talk about all the various cultures and civilizations that have used alcohol throughout the Stone Age. Alcohol is not isolated to our culture. Someone once said that wherever there's sugar, there's alcohol. And I think most of us realize that alcohol is made by fermenting sugar. The ancient Greeks and ancient Italians used grapes, which are certainly full of sugar, to make wine. The Germans brewed beer from barley. The Polish made vodka from potatoes. The Caribbeans, the Caribbean Islanders made rum from sugarcane. In Central and South America, they make tequila from agave. Honey, the ancient Cretes made mead from honey. In Brittany, they make hard cider from apples. Wherever there's a sugar source, you can make alcohol. So, the question is, since alcohol is ubiquitous throughout history and throughout the world, the question is why? Why are people making alcohol? And there's a number of answers to that. The first one is just ceremonial use. Like I was discussing earlier, alcohol is used in a lot of ceremonies throughout history and throughout the world. The Japanese use, in the Shinto religion, use sake as part of their religious ceremonies. In the Catholic Mass, we use wine as part of our ceremonies. People pour libations to the dead all over the world. In Mexico, tequila is left on the altar on the Day of the Dead as a gift to their dead relatives. Alcohol was also used to preserve things. One of the things about alcohol is it's antibacterial. And as a consequence, back in the less modern times, when we didn't have refrigeration and other forms of storage, people made alcohol because it would keep. Another thing was safety. Especially in the Middle Ages, when hygiene was a huge issue, water sources were often contaminated or unreliable. So people would make the water into alcohol, and therefore it was safer to drink. Obviously, we don't have those issues as much in this day and age. The last thing would just be what everybody knows about alcohol. People drink alcohol because it makes them feel good. It induces a state of euphoria. The euphoric stage from alcohol comes from a blood alcohol level of 0.03 to 0.12. Just so that you know, the legal limit of alcohol varies, but anywhere from 0.05 to 0.08. So that's, inside that limit there in the euphoric stage. Obviously, higher levels of alcohol cause all kinds of problems acutely or in the short term. But people drink alcohol because it makes them feel good. It's that simple. It makes them more relaxed, more confident. It increases their mood. It improves their mood. People have called alcohol a number of things. Like a social lubricant, Dutch courage, this kind of thing. There's a reason that people have been drinking alcohol, for these thousands and thousands of years all over the world, and those are the reasons. So, in the short term, alcohol has a number of problems that are bad for your health, especially when consumed in larger quantities. And again, we don't want to focus on that today. Today, we're really trying to focus on moderate alcohol use. And moderate alcohol use in the short term does decrease your memory, your concentration. It can blur your vision and slur your speech. The last thing that it does, and again, we're talking about just moderate alcohol quantities here, it impairs your judgment. How many times have you known a friend or you saw someone in the news that did something really stupid when they were drinking? And this is not only a matter of safety, it's a huge matter of cost. The amount of money that alcohol costs our society in terms of accidents, decreased work performance, no showing at work, all these things. These are huge costs to alcohol. So, I do want to spend most of today's program on the long-term effects of moderate alcohol use. So I think the first thing we have to do is to define what moderate alcohol use is. This is tricky because there's a lot of different definitions out there, but I think the most accepted definition is that moderate alcohol use is 2 drinks a day or less in men, 1 drink a day or less in women. And when I say drink, I mean 12 ounces of beer, 4 ounces of wine, or 1 ounce of distilled spirits like vodka or whiskey. So that's what we mean by moderate alcohol use. Just so you know, in my practice, I do not recommend moderate alcohol use. And I'm going to tell you why shortly. So I think it behooves us to start off talking about the health consequences of moderate alcohol use on your health when we talk about our brain health. Let's talk about our brain health, because in reality, I think most of us would agree that our brain is the number one most important organ. So what are the effects of moderate alcohol use on your brain? Number one is people that drink alcohol moderately have 3 times the rate of hippocampal atrophy. The hippocampus is one of the parts of your brain. It relates to emotion and memory. People that drink moderately, this atrophies 3 times more rapidly than people that don't drink at all. Alcohol consumption also causes a decrease in white matter integrity, which means that the areas of the brain don't connect as well. We have multiple areas of our brain that all do different things. And for us to think and process and execute functions, we need those brains to talk to each other. Alcohol decreases that ability. As a consequence of these 2 things, alcohol increases your dementia risk. People ask me in my office all the time, maybe they've got a family member that has dementia or a friend is going through dementia, and they realize how terrible it is. And they say to me, Doc, what can I do to prevent dementia? And I tell them the number one thing that you can do to prevent dementia is to drink less. The other thing, by the way, is to make sure your hearing is good. when people don't hear well, that's also leads to dementia. So, if you know somebody who's worried about dementia, if you yourself are worried about dementia, you need to drink less than you do. Alcohol is a definite cause of cognitive decline. The second organ I wanted to discuss is the liver. I think most of us are aware that heavy drinkers can get cirrhosis, but it turns out that cirrhosis can also be caused by moderate drinking. Alcohol causes liver inflammation, and liver inflammation leads to scarring in the liver, a process called fibrosis, which can ultimately lead to cirrhosis. Now, even moderate alcohol consumption can cause cirrhosis or end-stage liver disease in certain individuals. Those individuals can be at risk genetically. For instance, there's something called the alpha-1 trypsin deficiency, which is a genetic deficiency that puts people at risk. Now, unfortunately, or fortunately rather, this is an uncommon thing, although I do have several patients with this. But the other issue is obesity. People who are obese tend to have non-alcoholic fatty liver disease as well. And the combination of non-alcoholic fatty liver disease and alcoholic fatty liver disease can oftentimes lead to cirrhosis, even in people who drink moderately. And that's not rare in our society. As we know, 2/3 of our country is overweight or obese. So that's 2/3 of people who are putting their livers at risk by even moderate alcohol consumption. The third thing would be heart. And this is one that I like to talk about a lot in the office, because people will come in with stories about their aunt, Ethel, that lived to be 102, and she drank 2 glasses of wine every night, and it's the only thing that kept her alive. And there's all kinds of anecdotal stories about people with great heart health who are drinkers. But I'm here to say that the American Heart Association likes to point out that no studies have ever proven that alcohol is good for your heart. No studies. Wishful thinking is not a scientific study. We all want to think that a glass of red wine at night is going to make our heart healthy. It's simply not true. There's no evidence to suggest that at all. And I think one of the things that we have to do in this day and age is be evidence-based in our prognostication, be evidence-based in our recommendations. If you are looking to improve your heart health, you do not want to drink. So, what are the actual and specific heart issues associated with drinking? Well, number one, drinking is a major risk factor for atrial fibrillation, or something I like to call AFib. We're having a pandemic of AFib in this day and age, and a lot of that has to do with alcohol consumption. It also has to do with some other issues like sleep apnea and obesity. But AFib is an abnormal rhythm of the heart. I'll explain it to you very briefly. A stands for atrium. And in your heart, you have an atrium which pushes blood into the ventricle. As the atrium pushes blood into the ventricle, then the ventricle pushes blood into the rest of your heart. In people with AFib, their atrium just quivers like this. It's called fibrillation. As a consequence of that, the blood in the atrium doesn't get pumped out, and it has a tendency to clot. When it clots, it just sits in the atrium, and occasionally a normal beat will come across in the atrium, and it'll kick that clot out into your ventricle, which then kicks it out into your aorta, which then sends it into your brain. As a consequence of that, people with AFib have a 10-fold stroke risk over the normal population. That's one of the dangers of AFib. There are other ones as well. Alcohol is a cardiac irritant. It is a known cause of AFib. In fact, we used to call AFib holiday heart syndrome because it would occur in people who don't normally drink, but who over the holidays or whatever, drink too much, and they end up with AFib. I've seen it many, many, many times. So the primary risk of alcohol on your heart is atrial fibrillation. Number two is Hypertension. Alcohol is a vasopressor. If you consider this to be your artery, alcohol presses that artery, which means constricts it. And if you know anything about fluid dynamics, and we all do, this amount of fluid down in this much space means that the pressure of the fluid inside that system is higher. Alcohol raises your blood pressure. I've been practicing for 30 years. I've seen it for 30 years. The number of patients of mine who come in during dry January and all of a sudden their blood pressure is great, or they've quit drinking for another reason, all of a sudden their blood pressure is great. They stop drinking during Lent. I see this a lot. All of a sudden their blood pressure is great. Even moderate alcohol use is going to raise your blood pressure. And I try not to fight with my patients, but this is something that I really have to work on because I really want to let them know that 2-drink-a-day habit that they've had forever is bad for them, their health, especially their blood pressure. The number of patients who all of a sudden are on no blood pressure medications when they stop drinking, there are countless examples. If you are fighting with your blood pressure, if you know someone else who's fighting with your blood pressure, get them to drink less. The third thing would just be alcohol, unfortunately, has a lot of calories associated with it. I happen to love this beer called Switchback, and I'm honest about that. It's delicious. I love it. I probably have 1 to 2 a month. But a pint of Switchback has 300 calories. 300 calories. That's an immense amount of calories. Think about when you multiply that if you had a bunch of them. That's just a lot of calories, which leads to weight gain. And weight gain and obesity are major risk factors for heart disease. I'd like to say different things, but that's not the evidence. Again, I'm a doctor, obviously. I'm also a person that likes to go out and have a couple drinks now and again. But I limit it because it is not good for your health. We're going to come up with some recommendations in terms of, quote unquote, safe alcohol use. Unfortunately, there is no such thing as safe alcohol use. Let's use the word reasonable. We're going to come up with some recommendations for reasonable alcohol use. Okay, the next thing is your immune system. And I remember when I was living in Austria, the Austrians used to have this kind of idea that if you were sick, you would go out and have a couple of beers and that would kill the cold. That's a well-established Austrian principle. Unfortunately, it isn't true. Alcohol has a deleterious effect on your immune system. Alcohol alters the function of T cells and B cells, which are your main immune combatants, and that decreases your immunity and leads to an increase in infections. There are several bacterial and viral infections that increase with moderate alcohol use. Another way that alcohol damages or worsens your immunity is through it changes your gut biome. It also damages your intestinal lining. Think of this. When you ingest something like some type of microbacteria that might cause disease, your first line of defense is your gut biome. So that bacteria or virus, whatever you've ingested, goes into your gut, and it has the gut biome to deal with. If that gut biome is strong, we are ingesting these things all the time. We don't live in a sterile environment. Constantly, we're ingesting pathogens and things like that. We don't get sick all the time because our immune system is taking care of these things, especially your gut biome. The second thing is your intestinal lining. If your intestinal lining is damaged, then there's a barrier that's gone now for these pathogens to be directly into your system. So the bottom line, moderate alcohol use is bad for your immunity. And I don't know about you, but I hate being sick. I've said this before in this program, but it remains true. The German word for bad mood and ill is the same. The word is krank. And we use the word cranky in English all the time. I'm in a terrible mood when I'm sick. I just hate it. And thank God for my immune system because it keeps me only being sick, once or twice a year, and for relatively short periods of time. if you want your immune system to do its job, you really need to be careful about moderate alcohol consumption. I saved the worst for last, and the worst for last is cancer. Here's where the news is most sobering, and I use that word very specifically. Cancer risk goes up with moderate alcohol consumption. There are 8 individual cancers whose risk goes up with moderate alcohol consumption. The first one I'd like to talk about is breast cancer, because breast cancer, even 1 drink a week, increases your breast cancer risk by 10%. So if this is the one that's, that's pretty hard hitting, it's a slap in the face, but 1 drink a week increases your risk of breast cancer by 10%. The reason is because alcohol increases the amount of estrogen in your body, and estrogen is a known mediator of breast cancer. The second one would be colorectal cancer, which is near and dear to me because my father and my sister both had colorectal cancer. Alcohol consumption is a mediator of increased risk for colon cancer, especially in men. This is thought to be through the folate absorption. People who drink alcohol moderately. I'm not talking about heavy alcohol use here. I'm talking about moderate alcohol use, socially acceptable alcohol use. Those folks have a decrease in folate consumption, which is thought to lead to an increase in colon cancer. Liver cancer. I think we all know that people who drink have liver problems. And remember, I just was discussing that even moderate alcohol use can lead to liver issues, non-cancerous liver issues. But it also increases your risk for liver cancer. The most important one, though, is head and neck and esophageal cancers. This is the one where it really the numbers really kind of grab you. They grab me anyway. 40% increase in head and neck cancers and esophageal cancers from moderate alcohol use. In specific, I'm talking about oral cancer of the throat, of the tongue, of the cheek. I'm talking about throat cancer. I'm talking about esophageal cancer. These are cancers that we see all the time. I'm sure you know a relative or a friend or a coworker that had one of these cancers. 40% increase in these cancers from moderate alcohol use. And again, just to kind of reiterate, moderate alcohol use is 2 drinks or less per men per day, 1 drink or less per women. Why is there a distinction between men and women? And that's because men's livers work more quickly to detoxify alcohol, and therefore they're less susceptible to it than women. But there are genetic factors as well. As I mentioned, some people have alpha-1 antitrypsin deficiency. This is an enzyme that's useful for the detoxification of alcohol. These folks are advised by their physicians not to drink at all. But there's other more common factors. As I mentioned, women are more susceptible to the risks of alcohol, as are people who don't process alcohol and they form something called acetaldehyde. You probably know somebody like that. I remember this girl I knew in college, she would have a small amount of alcohol, and I'm talking about like a quarter of a beer, and her face would get bright red. I had a friend of mine in college who was Korean, and this same thing happened to him. It does occur more frequently in women and Asian people. And that is they lack an enzyme, acetaldehyde builds up in their system, and the most obvious thing about it is that their face gets really red. They get very flushed. Why it matters in terms of not just cosmetics is that acetaldehyde builds up in their system, and acetaldehyde actually causes DNA damage, and it prevents that DNA damage it prevents the cell from repairing that DNA damage. So that's another a group of folks that really should be careful with alcohol. So there are some other risks to moderate alcohol use. There's an increased risk in osteoporosis or thinning of the bones. There's an increase in accidental deaths. I already talked about the cost of moderate alcohol use in terms of accidental rates. Again, accidents occur at a higher rate in people that drink moderately. I'm not just talking about somebody that gets really drunk and gets into a car accident. I'm talking about moderate, socially acceptable alcohol use also is a cost to society. There are also age considerations as well. I have people come into my office, they say all the time, geez, doc, I can't drink like I used to, and that's absolutely the case. Your liver detoxifies alcohol. As you get older, your liver gets less good at doing that. To the point with, once people are over 75, and in particular 80, I really discourage them from drinking because they don't detoxify the alcohol like they should. And the alcohol builds up more quickly. It causes deleterious damage faster. So it causes deleterious health consequences more quickly and with less alcohol. Accident rates are particularly high in elderly people, even with moderate alcohol consumption. Obviously, for the developing brain, alcohol is a real no-no. Your brain, as a lot of us know, is developing until you are 25 years of age. You do not have full frontal lobe development, which is where you make choices. The frontal lobe is where decision making, our personality, all these things. Your frontal lobe is not fully developed until you're 25 years of age. So alcohol should be severely limited in people under 25 and over 75. So this leads us to the question that we've been getting to the whole time, and that is, how much alcohol is safe? And there's a simple answer to that, and the answer is none. I hate to say it, but it's true. There is no safe level of alcohol consumption. Any level of alcohol consumption is associated with deleterious health consequences. As I mentioned earlier, 1 drink a week gives you a 10% increase in your risk of breast cancer. And keep in mind now that's true for men and women. Obviously, breast cancer in men is much rarer, so a 10% increase doesn't present that much total risk increase. But for women, where 1 in 8 women who are going to develop breast cancer in their lifetime, that's a 10% increase is significant. So what is a reasonable level of alcohol for you to drink? That is a really difficult question. And I boil it down to 4 to 5 drinks a week. And I'll tell you why. I absolutely recommend against daily use. So people come in and say, geez, I have a drink every day and I only have 1. And I tell them 1 drink a day is bad for your health for all the reasons we've just been discussing. There's also something else when you drink every day, and that's called psychological dependence. Psychological dependence is your dependence on alcohol that is an addiction. Your body doesn't need it. You don't go into withdrawal if you don't have your 1 drink a day. But these people are psychologically dependent on it. I once knew a guy that once he went to Utah on a ski trip, and when he found out there was no alcohol there, he drove to Colorado every night for dinner so he could have a glass of wine with dinner. It isn't a lot, but you drove 100 miles a day just to get 1 glass of wine with dinner? That's psychological dependence. You should always avoid heavy use of alcohol. Heavy use of alcohol is more than 5 or greater drinks per day for men, more than 4 or more for women. Again, you get into heavy use, even if you don't drink all year and you drink heavy 1 time, that has damaging effects on your body, obviously increased accident rates, you make poor judgment, decisions, all those kind of things. So when we boil it all down, I tell people, listen, there is no good reason to drink for your health. If you were trying to make decisions strictly for your health, you will drink absolutely no alcohol. If you like to drink, like me, but you realize it's not great for you, I tell people 4 to 5 drinks a week at the most. Do not drink every day. And an easy way to do that is to make sure you don't have a lot of alcohol at home. Thank you very much for your participation and viewing. Cheers.